A Game Changer webinar on mental well-being, co-hosted by Z Africa and the Zurich Foundation, is working towards raising awareness, educating and reducing the stigma surrounding mental well-being among young people in Africa. To further unpack this initiative, we are joined by Akani Mkansi, the National Programs Coordinator of the organisation. I can appreciate your time. Now, the latest U report poll by UNICEF South Africa indicates that 73% of children and youth felt that they needed mental health support over the past year. This is an astronomical figure. Akani, can you hear me?
Yes, I can hear you. Thank you so much, Hugo, for the warm welcome, and good afternoon to you. What has brought more mental wellness over the past 5 years is because South Africa has been hit hard by social economic challenges that resulted in a need for mental health intervention. When we look at the past 5 years, we have experienced challenges with the COVID-19 pandemic. There's been high rates of unemployment amongst young people, poverty as well as inequality. According to the 2022 World Health Report, South Africa has poor mental health due to those factors. A study carried out by the Developmental Pathways for Health Research Unit in 2021 at the University of Witwatersrand shows that COVID-19 has worsened depression and anxiety, leading to fear because of the social and economic disruptions arising from the pandemic. Other factors that contribute to the need for health interventions include the increasing mental health conditions as well as substance abuse. Mental health conditions have also resulted in disability amongst 1 in 5 people. In 2021, I think this actually relates to what you have started the discussion with, speaking about 65% of young people stated that they are currently suffering with a mental health condition, but they have not sought any type of help.
So let's talk about this. The poll also revealed that 38% of young respondents actively sought help for their mental health concerns. Is this a good number in context of the number of young people that are struggling with mental health issues?
Absolutely. At the moment, about 25% of young people are currently struggling with mental illnesses. And one of the increasing mental illnesses that affect young people include depression. And looking at the DSM-5, which is the Diagnostic and Statistical Manual of Mental Disorders, shows that most young people are depressed. They have loss of pleasure in the interest in activities that they enjoyed the most. And this leads to loss of motivation, loss of interest in the activities that they enjoyed. But because of the increasing awareness that is done on social media in organizations that focus on mental health and illnesses, more and more young people are now aware of the symptoms, how to manage, as well as where to go when they need support for mental illnesses. So I think that could be the reason that more and more young people know where to go and the support that they might get when they consult with mental health professionals.
Now, Connie, one of the challenges with seeking assistance for mental health issues is acknowledging or recognizing that you have an issue. So, for instance, if you are depressed, how do you know that you're depressed? What are the symptoms of mental health that certainly individuals should look out for? I mean, how do I know that I have challenges? Or how can I diagnose or see it in those around me?
Okay, thank you so much for that question. Before I even answer that question, I just want to say symptoms vary by individual. One might be experiencing depression, but they are able to concentrate. and one other person might not be able to concentrate for longer periods. So some of the symptoms that one needs to look out for as they try to understand whether or not they're depressed, they need to understand that is it affecting their concentration for longer periods? Do they have feelings of excessive guilt or self-worth? Are they hopeless about the future? Do they have thoughts about suicide? Are they able to sleep or do they have disrupted sleep? Is there a change in appetite or weight? Feeling tired and low in energy. And as I've said, this is not a limited list of symptoms. One would have to consult with a mental health professional in order to understand whether or not they are depressed.
So now, for those that are looking for assistance, where do they reach out to? Who do they reach for information or for support?
Okay, so at the moment, one thing that one would need to do as a first step is to consult a mental health professional in order to understand and undergo a professional diagnosis. And once that is done, other areas or organizations that they can visit in order to receive support would be SADC, the South African Depression and Anxiety Group. There's also Lifeline, and there are other local organizations that offer free consultations.
Now, when we take a look at teenagers, there've been a reportedly high number of teen suicides. Part of that, I think, is a result of teen pregnancies. What are some of the other factors, and how do we counter the challenges amongst the teenagers or young people?
Thank you so much for that question. At the moment, the reason that most young people are currently depressed and experiencing anxiety is because of the socio-economic landscape of the country. If we look at the moment, there are high rates of unemployment. There are high rates of violence, gender-based violence, intimate partner violence, teenage pregnancy, as you've alluded, and those type of challenges might result in mental illnesses or disorders. And for one to understand what they are going through, they would definitely need to consult with a mental health professional. And those type of challenges might result in a mental illnesses. But it also depends on the support that the individual receives from their family, from their relationships, as well as the workplace. So they would need to have a broader understanding of the support that is available to them in order to be able to get help and support to make sure that they do well and they are supported in that process of recovery.
Now, when we look at illnesses and the stigma associated or the stigma around certain illnesses, if we take HIV, for example, many years ago, there was a great amount of stigma associated with being HIV positive, but largely that stigma has fallen away. We still find that there's a huge amount of stigma associated with mental health. Now, what is being done? What is your organization doing to advocate, to eradicate the stigma? Talk to us about that process.
Okay, so at the moment, we work with a very large number of young people. And as we all know, through the process of unemployment, one gets discouraged, one loses hope, and one loses motivation as well. So as an organization, we are running quite a few programs, entrepreneurial programs, that are aimed at equipping young people with skills to start their own businesses. We are making sure that young people understand that entrepreneurship is a viable career option. While you wait on a CV, you can definitely get started on a business and make your own money. So in that process, we also make sure that we integrate the mental wellness component to make sure that young people are supported with the psychosocial support that they would need when they start their businesses, when they undergo the process of registration, as well as managing their finances. How we do that, we make sure that they understand that entrepreneurship is not an easy journey. Firstly, they need to understand that in making money, at some point you will lose money. that is going to be very stressful for you as well as for your employees. They also need to understand that there are steps that they need to take in order to support their employees in that process, but they will also need support themselves. So some of the ways that employees and employers can support their people is to make sure that they have a balanced work schedule. They do not work extra hours that would lead to exhaustion, and make sure that time management is also makes up an important component of their everyday work.
Well, thank you very much. I appreciate those insights.